Hello everyone, my name is Umay Çelik. I'm a fourth-year medical student, and today I'm going to talk about hematopoietic stem cell transplantation, or with its other name, bone marrow transplant. So what's a bone marrow transplant? It's the transplant of the cells that are found in bone marrow, which are producing the cells in the blood, erythrocytes, leukocytes, and platelets. So what are the indications for bone marrow transplantation? So as we said, it produces erythrocytes, leukocytes, and platelets. So the diseases of these cells, for example, leukemia, thalassemias, sickle cell anemia, coagulation disorders, and immunodeficiencies. Types of bone marrow transplant can be allogeneic. Types of bone marrow transplant can be autologous, which means it's from the patient itself, patient's its own tissue, or allogenic, which means it's from a donor whose same tissue match as the person who's receiving the transplant, or it can be haploidentical, which means it's not a full tissue match, not a full HLA match, but half or more than half. This is not mostly preferred, but can be used in the cases that are like full match cannot be found. And examples could be like from a parent, from a sibling, or another family member for haploidentical stem cell transplant. Also, should I talk about it? Never mind. Methods for bone marrow transplantation are direct bone marrow harvest and leukapheresis. So in direct bone marrow harvest, there is this needle that you're inserting into the bone and directly taking out bone marrow in a surgical operating room. And in leukapheresis, you're giving the patient, and in leukapheresis, you're giving the donor granulocyte colony stimulating factor for 4 to 6 days before giving blood or going to the center, and they are attached to this machine which basically harvests the progenitor cells from their blood. So how do we do this bone marrow transplant? At first, we take a sample from our patient to figure out their tissue type, HLA factor. And then we find a donor matching to the patient. This can be from a direct donor, like a family member, a friend, someone who wants to donate, or we can just look at the tissue bank if we cannot find a match in the close circle of the patient. Then, after we find the donor, we wipe out the stem cells of the patient through chemotherapy or radiotherapy, and then we transplant the donated tissue and enter the post-transplant phase. So how do we understand if a bone marrow transplant is a success? So this is a process called engraftment. Engraftment means the tissue that's been transplanted to the patient starts producing bone. The tissue that's transplanted to the patient starts producing blood cells, which are erythrocytes, leukocytes, and platelets. So it's also called chimerism because chimeras are these mythological creatures. Oh, actually, we don't have to talk about that, do we? So how do we know a transplant is a success? We see this by a process called engraftment. And engraftment means that the tissue that's been transplanted to the patient starts producing bone marrow cells, which are erythrocytes, leukocytes, and platelets. So we call these patients chimeras because they have 2 different types of cells from 2 different people, which makes them chimeras. So we do engraftment analysis, or chimerism test, as some people say it, to see how much percentage of the cells in the blood are from the donor and how much are from the patient previously. So what we actually want to see is 100% from being donated cells. So what are the possible complications? So, okay, one of the most known is graft versus host disease, which can have symptoms ranging from dry eyes to multiple organ failure, and if not controlled, of course. And another thing that can happen is graft failure, which means the graft just simply won't work. And also these patients, because we did ablation, and these patients are immunocompromised, so they're really open to infections, and that can be a reason, that can be a complication. So what are the possible complications in these patients? They can have graft versus host disease, which is basically the graft tissue and the body fighting against each other because it sees it as non-self. It can cause symptoms from dry eyes to organ failure, unless it's controlled, and sometimes it cannot be controlled. Another thing that can happen is graft failure, which means the graft just does not work. Another high possibility complication is infections. That's why these patients are kept in sterile rooms until their immune system, their bone marrow starts producing the required cells again. Also, new cancers can be produced in these patients because our immune system is really strong against actually defining cancer cells and killing them. So that's it. I hope you guys liked the video.